I'm Renz, Byron, Escallar,
And I'm John Paul de Leoz.
and we will discuss the 2019 budget allocation in DOH. In the DOH budget, it is said 67.4 billion will be allocated to the Philippine Health Insurance Corporation, or PhilHealth for short, to fund the program providing affordable and accessible health insurance to indigent persons, senior citizens, and families. Universal health coverage ensures that low-income individuals stay healthy and productive, thus resulting in improved capacities to access higher income opportunities, Duterte said in his budget message to Congress. The proposed health budget also covers 15.2 billion acquisition of medicines, vaccines, and medical and laboratory supplies, 8 billion full immunization of 2.8 million children, 3 billion to strengthen the prevention, control, and eradication of infectious diseases. Duterte said the government would also boost efforts in ensuring the safety of the vaccines. At least 213 million will be allocated for the hiring of 425 surveillance officers to conduct activities to monitor the status of the vaccine children. To curb malnutrition, the government also allotted 118 million for the DOH Nutrition Intervention Package for the first 1,000 days program.
And for the budget preparation, the President meantime affirmed that the administration puts premium on the providing benefits to the poor families to help them deal with situations that threaten their welfare. To achieve this, some 88.1 billion will be provided to support our Pantawid Pamilyang Pilipino that will provide cash grants 4.4 million households, Duterte said. Priority will be given to those in the National Household Targeting System for Poverty Reduction, victims of disaster and rendered homeless and jobless indigenous people. Because of the continuous increase in the number of patients seeking for medical assistance as well as referral received through email, social media, and different agencies and institutions, our President said we need to assess and review program to know the progress we've completed and to continue providing support to the medical needs for indigenous patients in the region.
The Department of Budget and Management, citing the cut was the biggest in the proposed 2019 cash-based budget, the DBM explained that the massive reduction was because of the dismissal spending performance of the Department of Health, DOH. In the implementation of the Health Facilities Enhancement Program, HFEP, only 50 million was allocated for HFEP in the proposed budget, down from its 30 billion allocation in the 2018 General Appropriation Act, GAA, and 24 billion allocation in the 2017 General Appropriation Act, the DBM noted. Data from the DBM also showed that the proposed 2019 DOH budget was down by 8%, or 12.3 billion to 141.4 billion from its 2018 cash base, equivalent at 153.7 billion. As of March 31, 2018, the total disbursement for the HFEP have only reached around 13.5 billion, less than 10% of the total 138 billion appropriation provided for the program since 2008. The agreement with the Department of Health is that they will undertake a careful assessment of the program. That is what the 50 million is for Budget Secretary Benjamin E. Jokno said. Is the HFEP cost effective, or is it wasteful use of taxpayers' money? The DBM statement came after a number of legislators noted several decreases in the appropriation of several line items in the proposed 2019 budget. In the meantime, Jokno said DOH can spend its obligation balance it has incurred over the years for HFEP. Based on DOH figure, its unliquidated obligation amounted to 57.5 billion, while the unobligated allotment reached 27.4 billion, or a total of 84.8 billion. Jokno also challenged the DOH to explain how they will implement this obligation balance, which is higher than the DOH proposed budget for 2019. Along with the DOH study, the DBM will also ask the Commission on Audit to perform another special audit of the program. The HFEP first became a budget line item in 2008 GAA with the allocation of 1.66 billion. HFEP is also a multi-year program that began during the Aquino administration. This is meant to improve health facilities such as hospitals and barangay health stations, but recently marred by controversies due to alleged irregularities in its implementation. Proposed budget for 2017 is 90.9 billion. Thus, if we add the PhilHealth budget, the proposed DOH budget for 2017 will total 141.02 billion, or an increase of 15% actually.
And for the budget legislation, the mandate of the DOH stems from Article 2, Section 15 of the 1987 Philippine Constitution and the state. It is responsibility of the state to protect and to promote right to health of the Filipinos and still health consciousness among them. Further, the DOH Executive Order Number 102 mandate to ensure that the Filipino will achieve an optimal level of health. For the role of DOH, then it is provided to assist the local government units, the LGUs, People's Organization, PO, and the other members of the civil society, effectively implementing programs, projects, and services that will promote health and well-being to the citizens, prevent controls disease among the population at risk, and the risk that could affect their health, treat, management, and rehabilitations individual affected by disease and disability. And that's it. Thank you.
Thank you, ma'am. We love you.